Now, today's cover story.
Well, a young Abington, Massachusetts student is taking on a big task.
9-year-old Colton McGrath has cerebral palsy, and with the help of family and friends, Colton's giving the rest of us a lesson in life.
Anyone ever been mean to you?
Yes.
How did that feel?
I felt bad.
I asked Colton if he could tell people one thing, what would it be?
Please treat people nice and don't be mean. And be brave. Stick up for yourself.
Are you brave?
I try to be.
Colton is wearing one of his favorite t-shirts today. It says, "Winners never follow," and he doesn't.
This is how the first 8.5 minutes of my life began. I was born blue and lifeless as a result of the severe cranial hemorrhages and hypoxia that I suffered during my delivery. Additional birth injuries include a broken collarbone, a fractured skull, seizures, and the diagnosis of Cerebral Palsy, which means that I had nerve damage in and around my shoulders and arms. I did not get diagnosed with cerebral palsy until 6 months of age. The unfortunate reality about my condition is that I was perfectly healthy up until a tragic birth experience. I should have been C-sectioned because I was an almost 11-pound baby. But the midwives who delivered me insisted my mother attempt to deliver me naturally. It turned out to be the biggest mistake they could have made, and one that would traumatize my mother and impact me for the rest of my life. Most people are unaware about cerebral palsy and exactly what it is. I think there needs to be more awareness about it as well as other disabilities. However, even when there is a tragedy, there is sometimes a silver lining. I am so grateful to have had such an amazing team of doctors and nurses there to resuscitate me. When the 8.5 minute mark was passing, without me having taken a breath or having a pulse, it seemed hopeless. Then, at the 8.5 minute mark, a miracle happened. And to everyone's surprise, I had a pulse. I still could not breathe on my own, so I was on a ventilator. A priest performed an emergency baptism at the bedside because they did not think I would survive long. I was rushed into Boston by an ambulance. I spent the following weeks at New England Medical Center, now called Tufts Medical Center, in the neonatal intensive care unit. My mother was told that if I survived, I would most likely never be able to walk or talk. This was just the beginning of a battle that I continue to fight to this day. I learned sign language at an early age and used that as my only source of communication for the first few years of my life. I also had to use a nasogastric tube to eat because I did not have the suck or swallow reflex that babies naturally have, and because I had a hyperactive gag reflex, which put me at high risk of aspirating, which means choking on foods or liquids which could go into my lungs. I also have a seizure disorder as a result of the hemorrhages in my brain. I've been on lots of different seizure medications over the years, and finally my neurologist found 2 medications that work in combination to stop my seizures. This day, I take about 10 pills a day. Thankfully, I've now been seizure-free for over 7 years. Having cerebral palsy is one small aspect of who I am, but it has given me the drive and determination to overcome obstacles, and I think that those are two of my best qualities. I never have and never will forget that the doctors believed I would never walk or talk. In a way, I am thankful that they said that, because for my entire life, I've been committed to proving them wrong. I may not do everything the same way everyone else does it, but I've always given everything I do 100% effort. I've learned how to adapt and problem solve. To name a couple of examples, I can't write well or for long periods of time due to my tremors in my hands, but I'm very skilled at using a laptop. And although my rowing form was not exactly like everyone else's, I still earned a spot in the head of the Charles Regatta 2 years in a row and took second place in a regatta in Philadelphia. When people speculate about my physical limitations, it makes me work harder to prove them wrong. Cerebral palsy affects people differently because the brain is a complex organ and no two cases are exactly alike. My progression was remarkable in that it went against all of the medical opinions of doctors who reviewed my MRIs and CAT scans. As a young infant, I was prescribed AFOs along with a gait trainer to help my stability. A gait trainer is a big metal contraption that has 4 wheels and leather straps to harness me in. It has handles that my arms strap onto also. It held my upper body up so I could practice walking. I then progressed to using just a walker along with leg braces. Eventually my leg braces got shorter and shorter. They began at my knees and eventually they were only worn around my ankles. Part of this progress was due to an intense therapy program from the time I was an infant. I had physical, occupational, and speech therapy every week, sometimes 9 and 10 appointments per week. As I got older, I continued with a PT, but not as often, and eventually began going on an as-needed basis. At the same time I was having all these therapy appointments, there were medical procedures and surgeries too. I had painful Botox injections in the back of my calves to loosen my tight muscles. The type of cerebral palsy I have causes me to have muscle spasms and tightness. It isn't something you can see by looking at me, but my body constantly struggles in inner battle. The therapies and procedures I've endured were not enjoyable by any stretch of the imagination, but from the time I could understand words, my mother explained that it was something I had to do if I wanted to achieve my goals. In kindergarten, I had bilateral heel cord lengthening surgery to gain flexibility in my heels and improve my walk, which was stiff due to my muscle spasticity. I was in cast for 8 weeks afterwards and used a wheelchair. My mother was always trying to research and find out treatments that might help me. One was called the Trans-Electrical Stimulation, or TES, to strengthen my muscles. It consists of little round leads hooked up to wires in a small box that delivered electrical impulses to certain muscles. For years at night, I had to wear Zimmer splints. Those are big braces that go from my ankles to my thighs and Velcro on with a hole at the knee. They kept my legs straight at night and when worn together with my bivalve cast, which were cast worn on the lower part of my calves and ankles, they gave my heel towards a good yet uncomfortable stretch. Many nights while wearing all these orthotics, and many days while undergoing uncomfortable procedures, I felt like I was going through hell, but I never gave up because I knew that my hard work and effort would pay off in the end. There were also x-rays, MRIs, EEGs, CAT scans, upper GIs, blood draws, and so many other medical tests, but those became second nature. I was a little kid who never cried when I had needles or blood drawn because it was just a part of life as I knew it. To me, the part of my CP that I find most bothersome is my speech. Even though people can understand me, I speak slower than most people and have a slight speech impediment. Many times, I've found myself holding back from saying things, especially in front of people I don't know well, because I'm self-conscious about my speech. I wonder if they will understand me, and if they don't, if they will assume I have a cognitive issue, which I don't. I wonder if they will ask me to repeat what I've said. This I don't mind, because there have been times when I've said something to someone and then gotten a response that is completely irrelevant to what I had said. This can be frustrating, so I would much rather have someone just ask me to repeat what I said. I have gone to great lengths to try and improve my speech and prevent problems like this from occurring. At the urging of one doctor in Boston who is on the cutting edge of new technology and treatments, I've had Botox in my tongue to try and relax my tongue so that my speech sounds clearer. And yes, it was as awful as it sounds. Unfortunately, it did not help. I've also tried medications that doctors thought might relax my muscles enough to improve my speech. Nothing so far has made any difference. Recently I found out about something called neurofeedback. The initial test is called a QEEG, which was administered to me in August of 2013, just before the start of the school year. This test involves leads attached to various points on your head, and it gives a complete picture of the inner workings of your brain. The test is sent out to a place in Arizona, and they provide results about 2 weeks later. Once you get them, there's a doctor here in Massachusetts who will use that data to begin neurofeedback treatments to target specific areas of the brain in the hopes of improving speech and other things affected by my cerebral palsy. Although my CP affects me in many different ways, I have always tried my best to be upbeat and look at the bright side of things. Having said that, there are a lot of everyday challenges I have to face, ones that many people do not see and often take for granted. For example, I can almost guarantee that everybody in this room has poured themselves a drink and then carried it across the room in the past week thinking nothing of it. I would kill to be able to do that, but I can't. If I were to carry my glass of milk across my kitchen to the table, I'd be lucky if half of that glass still had milk in it by the time I got to the table. The type of cerebral palsy I have includes tremors, mostly in my hands, which prohibits me from being able to do what many people perceive to be simple tasks. However, I am not at all uncomfortable about talking about this, nor am I embarrassed or ashamed by it. I've learned to roll with the punches, and I acknowledge that I am who I am, and that I cannot do anything to change the hand that I've been dealt. There are always people with greater struggles, and I try to keep it all in perspective. What I can do, however, and what I feel is actually a gift in a way, is to try and use my experiences to help others. Many people make assumptions about CP that are not always true. Trust me, I've experienced it firsthand. Here's an example. 2 years ago, I suffered a back injury. The pain was an issue, so I went for an x-ray to see what was going on. It turns out that I fractured my lower spine in 2 places, probably from a repetitive strain of rowing, which I was doing several days a week in Cambridge on the Charles River. Anyway, when I went into the x-ray room, the nurse said to me, "Colton, what is your date of birth?" I told her my date of birth, and her response was something to the effect of, "Wow, very good, you must be really smart." She used a tone of voice you would typically use if you were talking to a 5-year-old. This really got under my skin, yet despite feeling very frustrated, I think I made the right decision to bite my tongue and not say anything. I was caught off guard, and I didn't really know what to say. Right after the x-ray, I immediately asked my mother if my medical records indicate anywhere that I have a cognitive delay. I knew it didn't, but sometimes medical records are inaccurate. She said of course not, and that the nurse probably assumed that because of my diagnosis, together with my speech impairment, I had a cognitive issue as well. It is a common misperception. Although many kids with cerebral palsy do have cognitive issues, not all of us do. I guess I'm fortunate in that way. It is because of people like this, who probably mean well, but are uninformed about the wide spectrum of types of cerebral palsy, and who do not realize that you can have mild cerebral palsy without any cognitive delay, that I started a website when I was younger called Colton Cares in order to advocate for cerebral palsy. On the site, I explained what cerebral palsy is, and I talked about my personal experience living with CP. I talked about my childhood and the progress that I made over the years, in large part due to lots of hard work and therapy. The site also contained links to newspaper articles and news stories that were written about me and my experiences and advocacy efforts with cerebral palsy. In 3rd grade, I made a video with the help of a girl I liked since 1st grade, and I admittedly still like her and look up to her today. I obviously know a lot more about CP now than I did at the time we made that video, so it's not extremely informative. However, it is a Q&A where she asked me questions about having cerebral palsy and I answer them. It was intended to show my peers that I was a normal kid despite that my body worked a little differently. One opportunity that I'm proud to have been a part of are the public speaking engagements that I've done. Many of them are thanks to a doctor that I've had since the day I was born, Harry Webster. He is an internationally renowned doctor who is the chief of pediatric rehabilitation at Tufts Medical Center. He specializes in cerebral palsy, and on a few occasions he has invited me to be a guest speaker at various venues. One of the engagements was at a benefit for twins with cerebral palsy that were patients of his. The family was in need of a wheelchair van to transport the kids in their wheelchairs. I delivered a short lecture that lasted about 10 minutes. I described living with CP and some of the challenges that I have to face. The twins have far more involved cerebral palsy than I do, so I pointed out our similarities as well as our differences. I also presented the family with a check for $300 that I had raised through my website. The family was gracious enough to present me with an award for my advocacy efforts, and I got a standing ovation, which was very unexpected. Despite being nervous, I was happy to do it, and it felt in a way like I was speaking for Matthew and Melissa, the twins who could not speak for themselves. The most prestigious speaking engagement I was involved in was at Tufts Medical Center. Dr. Webster asked me if I would speak in front of an auditorium of over 200 medical students and residents. As nervous as I was, I said yes. It was hard to say no to a doctor who had done so much for me over the years. I delivered a very similar speech to the one I did at the benefit for the twins, except this time when I finished, Dr. Webster made me stay up there with him as he talked. He would occasionally ask me questions and try to include me in his speech. It was a great experience that I will never forget. My family was in attendance, along with a few of my friends. I had a lot of support and my speech was very well received. I cannot talk about my life with CP and how I've gotten to where I am today without mentioning how important my family has been throughout my journey. As I've always said, my best friend is my grandfather. He will always be there for me in good times and in bad, and I cannot begin to thank him for everything he has done for me. I have videos at home of myself as a toddler, and looking back at them now, I can see the effort he put into helping me. He was always on the floor playing with me or holding me up when I couldn't stand, and helping me to move my legs so I could sense what it might feel like to walk. Above all else, he always kept me entertained. To this day we sit down and talk for hours on end. He knows me so well, and we have an unbreakable bond. My grandmother also deserves credit for my progress. She has been willing to lend me a hand whenever I have needed one. She is very kind and very helpful. From the time I was little, my grandmother has always told me to never ever give up. Those are words I live by. My grandparents have always believed in and encouraged me. However, if there's one person that I have to thank and give credit to for everything she has done for me, it would be my mother. She has done more for me than anyone ever could. She's the one who took me to my daily doctor's appointments as a young child, often driving into Boston and spending the day there with me. She was the one who got me Dr. Webster. She's the one who found out about every treatment available to help my progress, including therapeutic horseback riding and adaptive swimming lessons. She's the one who taught me to believe in myself, to work hard, and be grateful for what I have, and she's inspired me to achieve all of my goals. Most importantly, She's the reason I am who I am today. Living my life with cerebral palsy has really changed how I look at things and has strongly influenced who I am as a person. CP has taught me determination. It has taught me determination in achieving goals I was told I would never achieve, like walking and talking. It has taught me that I can do anything I set my mind to, even if I get there a little differently than other people. CP has also taught me to be positive. Throughout my life, I realized that it is pretty easy to look at the negative side of things. In my opinion, that is not a good way to be. It just kills the spirit. You should always look at the positive side of things. If you find the silver lining, life is much easier, happier, and fulfilling. My goal in presenting this lecture is to spread awareness of cerebral palsy and to try and prevent others from making uninformed assumptions. The most important lesson that living everyday life with CP has taught me is to never say never. If you fail at something, do not quit. Try and try again. As my stepfather always says, if you want to see Colton do something, tell him he won't be able to do it. Thank you.
Hey, Colt. Alright, let me see you hit a bullseye, Colt. No pressure.
Receiver.
Whoa!
He did.
Whoa.
Wait, let me zoom in on that.
Oh, baby, hold on.
No, it's the
That's awesome. Colt,
Who's
you're...
the man?
Colt.
Who's the man?
Yeah. Nice shot, Colt.